Right, so this is part of the quadriceps femoris. We name it quadriceps because it has quadri meaning four parts. So we have the rectus femoris, then we have three vasti, a vastus lateralis, a medialis, and an intermedius, which is behind the rectus femoris, right? And this muscle is going to cross the knee joint, with the exception of the rectus femoris, which will cross both the knee and the hip. So when a muscle is on the anterior thigh, if it crosses the hip and the knee, on the knee joint, it's going to extend, but at the hip, it's going to flex. So meaning to say that this quadriceps femoris, yes, it's going to be the main extensor for the knee joint, but it is actually also going to flex at the hip through the rectus femoris. The nerve innervation for the quadriceps is via the femoral nerve, in particular the posterior division of your femoral nerve. So this is the rectus femoris. It's going to have two heads. By now you know that rectus means straight. So this is a long straight muscle, which is somehow bipennate, as you can see. And it originates, it is a straight head and a reflected head. The straight head is from the anterior inferior iliac spine, which you remember when you look at the ligaments of the knee joint, that's going to be part of the attachment of your iliofemoral ligament. Right. Then the reflected head will originate just somewhere above the acetabulum, so in that region there. Right. That's where you have the reflected head of your rectus femoris. Right. Then I'll skip its insertion for now. Then when you look at the other two muscles, which is three rather, the vasti, your vastus lateralis is from the upper end of the shaft of the femur. The same can be said for the vastus medialis, is the upper end of the shaft of the femur on the medial side. Then the vastus intermedialis is also from the anterolateral surface of the femur. So these muscles, they converge into what we call the quadriceps tendon. And this quadriceps tendon will come and insert onto the patella, right? Then from the patella there, we get what we call a ligamentum patella, this one. It is the ligamentum patella that will then go and insert onto the tibia, where on the tibia, particularly on the tibial tuberosity, right? So that makes up your quadriceps femoris, right? Remember that it has those four parts, right? Then some of the fibers of the vastus medialis rather will form what we call articular slips or tendinous fibers that actually form bands, which we call retinacular, right? Then blood supply, it's via the femoral artery, which is the artery of that compartment.